The opioid epidemic in America continues to be a big issue. It's very important stuff. But here now to tell us more is Reinhard Straub. Sir, good morning. Nice to have you here.
Good morning. Pleasure to be here.
Before we get into it here, tell us a little bit about where you're from and what it is you're really doing day in and day out.
Well, I started Clinical Services of Rhode Island in 2011, and then last year I sold it to American Addiction Centers, a national company. We have facilities all over America.
And you're really helping people out, and I think a lot of people have sort of a misconception. They're not sure if addiction is actually a disease or not. So answer that one for us. Is it really?
It's a brain-based illness. We're doing some exciting research in our lab. We've isolated genomic, the genes of it, and which are targeting therapies. I think that's the wave of the future.
It really is. And you were telling me some remarkable strides are being made within this field. You're learning more and more as the years roll on about different ways to help people, aren't you?
Absolutely. And I think getting the word out as to what is effective treatment is probably the most important. I educate all over the country, and I'm just amazed at how little people really understand the illness.
You know, the epidemic itself, the opiate, am I pronouncing that correctly?
Opiate.
Opiate epidemic itself. What exactly are the causes of this, if we can be kind of on the lookout for some signs?
Well, from my what I think is because we've quadrupled the opiate supply in America, and we've quadrupled the overdoses in the same period of time. Doctors mean well, and they do a great job, and they're caring folks, but the problem is the proliferation.
Right. Do you find that people who are sort of either know somebody or are concerned themselves that they might be afflicted or whatnot or have this addiction, they don't really know where to turn, they don't know where to start?
I think, I talk to a lot of mothers, fathers, sisters, brothers, and they go online and they look, and, they get a lot of advice that maybe not the best. We try to target the resources and to design a program that's going to work for each individual.
Well, is there a certain, gold standard, so to speak, when it comes to treatment that people should be subscribing to or making their way toward?
I worked for the New York State Medical Society's physician health program for 7 years, and we had almost a 90% recovery rate. Doctors stayed sober in our program for 5 years. Wow. If you look at what the general population is getting in terms of treatment, 25% within 3 years are sober. So, and when you give doctors the treatment that the civilians get, they have the same dismal results as the rest of the folks.
Well, certainly we all need to start somewhere, and I think we all know somebody that certainly is battling something, and for you to sort of provide this jumping off point is so crucial. Do you see yourself as providing that service, don't you?
The greatest predictor of a positive outcome is how long somebody's in treatment and how long somebody is involved with chronic management of their illness.
Well, it's also very important, and we can't thank you enough for shedding some light on it with us and for sharing your knowledge. Reinhard, a pleasure to meet you. Thank you for being here. If you'd like to learn more about this, just head to rhodeshow.com for a link to Clinical Service of Rhode Island's website.